Today I'm having my laparoscopic sleeve gastrectomy done this morning. Started bright and early at home at 4 o'clock, getting ready to come in and beat the traffic into the city. So now we arrived at the hospital and kind of getting things underway, getting the vital signs taken and answering all the necessary questions for surgery. Trying to keep the butterflies down.
I'm excited for him and a new lifestyle. I have full faith in Dr. Jones. He's awesome.
Good morning.
Good morning, how are you?
How you doing?
Good.
You do 5? All right. Well, Dad, you ready to go?
I'm ready, yes.
All right. Any questions about anything?
No, I think we're good. It's going to be a whole new life for me, so I'm looking forward to that, looking forward to seeing what the results are.
A big high five.
Yes. All right.
All right, I'll see you.
All right, thank you. Okay.
Yeah, love you soon.
Love you.
We're set up here to do laparoscopic surgery. The goal here is to try to do a big operation through very small incisions. During the procedure, what we'll be doing is we'll be mobilizing the stomach off the spleen. From there, we'll be calibrating the size that we want to downsize the stomach with a bougie catheter, and then we'll fire the stapler along the catheter, and this will make the tube or the sleeve, which is the goal for today.
This is just a really happy day for Jeff, and we're very excited for him. I've known Jeff for 100 years, and he's really struggled with his weight. When he made this decision, we were just so thrilled. And I told him this morning, I said, you just gave yourself and your family the greatest gift you could give. I said, so at his age, this is just wonderful. Young family, he's going to be so happy, and we can't wait to see him when he's finished.
Hi Mary, it's Dr. Jones. Everything went great. So we're done with surgery, we're just finishing up on the incisions. Anesthesia will wake him up, and then as we spoke about, he'll go back to the recovery room. Okay, so everything went really well. Well, it's just a few tablespoons of blood. Did not put a drain in. Everything looked good on the staple line, on the leak test, so we're expecting the best. It's been about 3.5 hours since surgery. How are you feeling?
I'm feeling good.
Any pain?
A little bit, but nothing that that I didn't anticipate. So
Everything went great.
I think I've got the toughest part behind me. Now I just gotta spend my 2 nights here, and then I can get on with life on the outside world.
Walking is extremely important for patients, especially post-op, because it increases healing. It doesn't have to be a long distance, it can even just be a little bit in the room, but we do have him walk right away, and he was up and walking and doing great.
It's a little painful getting up and out of bed, but once you get up and walk around, I feel good. It's a sense of accomplishment that things are heading in the right direction. I'm really not hungry, I'm more thirsty than anything. It's kind of one thing I was afraid of. I'd be sitting here for 2 days starving, and I'm not. Today I a lot less pain. I did a lot more walking around. I probably walked the halls about 4 times. I went down for my upper GI test. They looked to make sure that there was no leaks in the stomach and that everything looked as though it was healing correctly.
When Jeff came back from his test, once they put in the order, we started him on the bariatric stage 1, and he started drinking the water. He was doing great. He didn't have any nausea. All the nurses on this floor are trained in bariatric surgery, so we all know exactly the steps and how to take care of them, and everyone gets the same care, and it's really good care.
It's nice to have someone who focuses on that constantly throughout their practice so that they can become an expert in that field.
So we advanced Jeff to the Crystal Light. He did really well, so we're going to advance him to the protein shakes, and as long as he does really well with this, which I foresee happening, he'll be going home on protein shakes and with a packet that includes other foods that he can eat at home.
We'll be ready for him. We'll get all the shakes and that ready, and the plan for after surgery.
My wife will be home with me for the first several days, and then my dad's around, and my daughter's been wonderful. She last night wanted to stay here and hold my hand through the night to make sure that I was okay. So I have a great support structure in place that I'm not sure what to expect, but I think as we go through the process, we'll figure out how to manage it and get through it. And I think that's important to have that in place prior to surgery. finally getting to go home and see the family. I feel really good today. They disconnected the IV pain medicine and the IV fluids, and I've been holding down the fluid, and the protein shake stayed. I did well with that this morning, so I get to go home and start the process at home.